what's important here.
Thank you.
So principles, I was thinking about it while you were working, and I kind of divided it a little bit. So when we talk about the body, the principles of the body, how do we want the body to be when we're working? I know I've written things on the board, but pretend I haven't. So think for yourself, what would
Whose
you
body?
like? The practitioner's body. How do you want to use your body? How does it need to be? Relaxed. Supple. Focused. I've put flowing. I've put dynamic flow. Do you know what that means? Like it's alive. Yeah, it's alive. Who said alive? So it's an alive flow, but it's a relaxed, soft flow. We had the push-pull. So the principles of when you're going down the body, there's a push. When you're coming back, there's a pull. And sometimes there's a side to side. Yeah? That's how to use your body. And this part of your body is dictating where you're moving. What we haven't talked about is the hara spotlight. So wherever you are should be within this beam of light. So say for instance, my client is here, my hara is here, my spotlight's here. What if I want to go there? That doesn't work, does it? So I need to move my body. Some of you kind of got a little bit lost with that. So move your body where it's in the direction of where you're going. So that front foot in the direction of where you're going, your bottom in the direction of where you're pulling. So I can't have my bottom here and pull here. It's not going to work, okay? So the hara spotlight, alive. We talk this word dance. How many of you felt like it was a dance? Somebody said it to me. Was it you, Brad? It is a dance, he said. It is a dance. Yes, it's a dance. It's a dance. What about the hands? What's the quality of your hands and your forearms and all the areas you were using?
They have to be soft, because if they're rough, the patient will feel them.
Yeah, so soft. What do you mean by soft? When your hands are on your receiver, when we say soft, what does that mean?
Light touch.
Maybe a light touch, but you might go a deeper touch as well. So what's the quality of the touch?
Firm.
Might be firm, might be light, but there's still a softness.
Mm-hmm.
So here's the difference. I can make a fist like that. Is that soft or hard? That's hard. What if I went in with those knuckles? Would that be hard? Would that be uncomfortable? But what if I use my knuckles and just brush through? What about that? Is that soft? Yeah, a lot of you were doing that using the back of your hands in all sorts of areas and moulding them. Because that's the other thing I've put here. They're sensing, they're moulding, they're adapting. So wherever the curves of your client or your receiver is, find a way to move within those that's comfortable. The other thing is we don't want any joints to be strained. So generally we talk about things being aligned. That word there, aligned. So no hard angles with what we're doing. So sometimes we want nice, soft, but straight joints when we work. We're going to do a little bit more of that after the break. Listening, I've put listening. Do you know what that means with your hands, listening? Huh?
Feeling the client's energy.
Feeling the client's energy. Feeling what else?
Breathing.
Feeling their breathing, feeling the tension, feeling what the tissue feels like. So your hands become like your ears. I'm going to just kind of go in there and notice what it's like. And then as you're massaging, you're noticing all the time, listening with those hands to check out what's different. Yeah? I put here, your hands, with massage, it's not about doing to your clients. It's about being with your clients. It's about allowing your hands to contact and connect and be with and subtly change those tissues rather than doing to. You know, I have to fix this. So if any of you have in your mind the idea that you're fixing, forget that. It's a persuading. I use it like, I think of my hands like they're coercing, they're persuading, they're gradually kind of allowing the person to let go. Yeah? So forget the fixing. When we add pressure, where do we add it from? Where does the pressure come from?
Your legs.
The legs, the lower body. And we're leaning. Some of you did some fantastic leaning, really leaning in. There's where the pressure comes from. And the other things I've written here are that sense of groundedness. So get your feet, that feeling that you're connected, that you have those roots really allowing you to feel so grounded. And somebody said earlier, bouncy. There's a bounce from that place. There's an energy from that place. It's not flat. There's nothing flat about that. And what we've just done, and I want this to stay with you for the rest of your training, is you're curious. What's there? What's under your fingertips? What's going on there? And you're going to play with that. If you stay curious and playful, rather than I have to fix this, then you're doing a great job. Okay?